don't risk severe complications. This is a video of how cryoablation is performed. Just a couple of minutes, and it shows that these patients can go home on the same day. This patient is lying inside this white donut, which is a CAT scan. This is what a lot of people here have CAT scan. They lie down, they have some sedation. We numb up the skin area. This is a cryo probe. So basically some argon gas is going in there, and you can see an ice ball forming at the end of this. So you can see we're testing the probe by putting it in some water to see if it actually forms the ice ball. Now we do this with most of this work is done by the radiologist, and what we're doing here is sighting the tumor. You can see a little lump here on the kidney, that's the tumor. This is our needle going in to make sure that we're near or hopefully inside the tumor, and that's what we're trying to freeze. We're trying to create this ice ball around the tumor. And here now the probe is going in, the patient is awake, but we use local anesthesia for this. And this patient, this particular patient, had very severe COPD, very severe heart disease, and the tumor was slowly growing. So we did not want to put him through general anesthesia, yet we wanted to do something for this tumor. And this tumor was on the outside. It was smaller than 3 centimeters, and it was not near any other bowel or any other major organs. So we could go ahead and do that.
How much radiation are they exposed to while they're in, compared to a normal?
That's a great question. It's never been measured, but it's probably equivalent to 1 CAT scan where patients get 3 phases of CAT scans. So
okay.
It's not something you want to do every day, unless they really want to support the hospital. So cryoablation versus RFA, this is a question we get a lot. There are no definitive comparisons of the 2 techniques. Radiofrequency ablation, I'm almost certain, has more complications. But again, there's never been a head-to-head comparison in a randomized way. Both have very short recovery, so most patients get up and go home a couple hours later and do really well. But the overall complication rate is similar to surgery, which is partial nephrectomy, yet with a quicker recovery. It's inferior to partial nephrectomy for long-term cancer control, because 5 to 10% of patients have cancer that come back locally and need more treatments. And it's really, at this point, only suitable for patients who refuse or cannot go under cannot undergo surgery for some kind of major medical problem. Now, where are we heading? This will just take a couple minutes. One investigational, and I want to repeat, this is investigational treatment of kidney tumors that we're using is something called CyberKnife, which is a way to deliver pinpoint radiation with millimeter accuracy using this huge elevated robotic radiation delivery device. So the radiation beams can be as small as just about a half a centimeter wide, and this robot can go in any 360-degree direction to deliver that beam such that it targets the kidney mass, or really any mass in the body, very, very deliberately and very exacting. And it can also move with the patient's breathing, so the patient doesn't have to undergo anesthesia. The patient can just go in, lie down on the table, breathe very slowly and regularly, and this huge robot will move a couple centimeters as the kidney moves inside the patient. As we breathe, our kidneys move down and up very, very subtly. This can move with the kidney so that it targets just the tumor and doesn't hit any surrounding tissue. This is a planning picture. So this patient had a very centrally located tumor, which is the red inside the kidney, which is yellow. So if he had undergone surgery, we'd have to take this whole kidney out. Yet this patient had some renal failure. He was well over 75, and we wanted to try to save this kidney, yet treat him in some way. This is a planning picture, so you can see all these directions of these beams before this actually happens, going in and targeting this zone in the middle of the kidney. And this is a very shaky video. I took this myself of a patient actually about to undergo CyberKnife. So again, centrally located renal mass, the patient with some renal problems. This is a picture of the CyberKnife. We call it a robot. It's basically one of those huge BMW car robots, which is very fancily refitted to deliver pinpoint radiation. This is the patient. He comes in, he lies down. He's had a gold seed placed in the tumor, a percutaneously. So we do actually have to perform a procedure prior to this by putting a little gold seed inside the tumor. And you can see now the robot making its way around, delivering its beams around the patient, and can't see anything, but it is happening. And it's going exactly where we want it to be because it's been pre-programmed by the radiation team to deliver its beams exactly where it wants to go. So again, patients are awake, there's no anesthesia, they don't get touched, and for kidney tumors, they have to have 3 sessions of this, and each session is about 45 minutes. So they come in on a Monday, Wednesday, and Friday on a particular week, they get 3 treatments, radiation, he gets up, takes off his oxygen, and he goes for a jog. There he goes. So it's a very, very